To many in England, this report is no surprise.
Some of these failings are literally life and death. Take the waiting times in A&E. More than 100,000 infants waited more than 6 hours last year. And nearly a tenth of all patients are now waiting for 12 hours or more.
The report also found that 14,000 people a year were likely to have died because they were waiting too long, sometimes over 4 hours for emergency hospital treatment, that you're more likely to die from cancer in the UK than other countries, and that the health of the nation is getting worse, with a rising number of long-term mental health conditions and 2.8 million people who are too sick to work.
The last government broke the NHS. It is unforgivable. And people have every right to be angry.
Just look at this graph showing patient satisfaction in England falling to record lows. With many unable to see a doctor or get a hospital appointment, the perception is that there's not enough money or staff in the NHS. But the reality is that funding has been at historically high levels along with staffing, but that hasn't always translated into treatment, with record numbers waiting over a year for an operation. The fundamental problem with the NHS in the UK and in England is that there is an ageing population and not enough social care money to look after the elderly. So they end up getting treated in places like this, hospitals, instead of at home. It's a problem that successive governments have promised to fix, and they haven't.
The NHS may be broken, but it's not beaten. As the report says, the NHS may be in a critical condition, but its vital signs are strong. And we need to have the courage to deliver long-term reform. Major surgery, not sticking plasters.
Starmer says he wants more investment in digital technology and care in the community, plus a bigger focus on prevention instead of treatment. But that costs money. The government promised not to borrow or raise taxes for working people, leaving some wondering where the government will get the money from. Paul Hawkins, TRT World, London.